Okay, Mr. Vince, once your teeth are finished, it's very important that you follow. You have to use tooth floss. For example, there's a special floss that we use in cases like yours for crowns and bridges, which is called super floss. I'll show you how to use it in a moment. Hydro floss or water pick is also very useful because it helps go into the areas with high pressured water where you cannot reach with the floss. And also a mouthwash is very important because it'll help you rinse all the areas around where we built the implants and the crowns. Or in other cases, for example, with patients that have veneers, composite resins, any type of restoration, all protocol for instructions of care and hygiene are more or less the same. Also, when you eat, it is very important and it's recommendable that you do not chew. For example, if you're going to eat an apple, you do not bite it straight up with your teeth. It's better to cut it off in slices and then you put it in your mouth. You have to try to avoid chewing, for example, ice cubes or peanuts or nuts. If you're going to do, for example, peanuts, which all of us like, it is very important that you do it gently and in small pieces. You're trying to test, like testing the waters and see how it feels. Also very important, avoid something that is totally forbidden is taffy. No taffy or very hard candies, because the porcelain, although it's very hard structured that is against a metal base or a zirconium base, it is very important that you do not put excessive forces on it because it can chip. Okay? Also, you must know that if you smoke or if you consume alcohol excessively, that can harm your hygiene and that can harm your oral condition of the implants and all subsequent structures. Anything that you would like to know?
No, not so far, no.
You're doing okay?
Yeah.
Something else that you must know, Mr. Delina, all of the work that is done by this office, any type of restoration, including implants, crowns, veneers, composites, root canals, everything, is under warranty for as long as you are a patient of this office. This means that if you ever have a problem, we will always fix it or replace it at no extra charge for you for as long as you are a patient. That means that you would have to pay us a visit and we will address any issue. You can communicate with me, email, telephone, or whatever. Okay, Mr. Vince, now that we've been through the verbal explanation of how to take care of your teeth, I'm going to show you with Gabriela in a mirror how to use the Superfloss, the interdental toothbrush, and where are the areas that you need to reinforce your hygiene and where are the areas that you're going to apply the water pick. I'm going to simulate that with the mirror and my little instrument, okay? I'm going to bring it down. Okay, Mr. Nina, take a look at this. This is an interdental toothbrush. It comes in two pieces. This is the part that you will always keep. And this little cone-shaped brush is the part that you always replace. It's like a spare little brush that you replace. This is how you do it. You open up here, then you push it here, and you close. Okay. The objective of this brush is to clean every area that you cannot reach with your regular toothbrush. So, for example, you're going to hold the mirror so you can see where I'm going to clean. You see here, Mr. Vince? Mm-hmm. You can twist it a little bit so it's easier for you to clean. You see how it brushes? Mm-hmm. It brushes in the pontic areas where the floss will not come from the top. You see? You brush here. You brush here. So if you combine this toothbrush, interdental toothbrush, with a water pick, it does a great effect because you brush and then with the hydrofloss or water pick, you put pressured water here, gently pressured water. Remember that the water pick has different intensities. You have to start as gentle as possible, and then depending on how you feel it, because it's a very subjective experience, you can graduate the power.
Okay.
So after you're done with the interdental toothbrush, all around on these areas, you see? In some areas, it will fit better than the other ones. You just have to try one by one. You can even put a little bit of toothpaste here on it. Once you're done with this, you go with the water pick, and then you brush.
Okay.
And finally you rinse, and that'll give you a very good sensation of hygiene in your mouth. Now we're going to show you how the Superfloss works. This is much easier to use than the Superfloss, but for example, if you don't have this one, you can still opt for the other one, or you can even use them both. Okay. You see, the difference between this floss and the other ones is that it has a hard tip edge. Because the regular floss, when you push it, it twirls. This one won't. Now we're going to use the Superfloss in your top teeth. For example, you have to use it all around, but I'm going to place it in the front because it's much easier for you to see in the mirror. You push it here. You just push it. Then comes, you see this cushion part? A little bit thicker. Then you just, you see? Right here. And this cleans you all around. You see, you got a little bit of debris out. So this is a complement with the interdental toothbrush and the mouthwash. As a matter of fact, I'm going to do a little demonstration here with the interdental one. You see, you do it right here. In some areas where the interdental toothbrush is too thick, I don't want you to hurt yourself. If this is very hard to get in, you use this one.
Okay.
All right. And with the water pick and the brush and the mouthwash, it will be a great complement. These adamants can be used by anyone. As a matter of fact, I recommend them for any patient with restored teeth or just natural teeth, because it helps them keep good hygiene and overall good oral health. As I mentioned to you, mouthwash is very important. I have no strings attached to any brand. As long as it's a healthy, good mouthwash, you can use it. You can even put a little bit of it in the water pick, so you can pressure water with it, and you'll feel great. Okay. And you got you know what precaution measurements you need for eating, for hygiene, and for consumption.
Okay.
I want to thank you for coming to this office and giving us the honor of treating you and meet you as a friend.
Okay, it's been a pleasure anyway. You know, I really enjoyed it. You know, I like the mouth job. You know,
All right.
it's really good.
Okay, Mr. Vince. I'll see you again.
Okay.
Bye-bye.
Bye.